Thursday marks the one-year anniversary of when the World Health Organization labeled the CCP virus outbreak as a global pandemic. Now, we look back on the history of the infection, how it started, and how Beijing's response impacted the outbreak's timeline. As far back as November 17, 2019, the South China Morning Post reported on a case of what was at that time an unknown flu-like illness. The report cited official documents. Weeks later, on December 1st, the earliest documented patient was found to be infected with a strange sickness. According to a China-based study, the first evidence of human-to-human transmission was found in mid-December. But as part of Beijing's cover-up, that information was not released to the public until much later. Further research from a lab in China revealed the virus's genome sequence on December 27th, shedding new light on how the infection attacks the body. 3 days later, famed Wuhan doctor Li Wenliang shared a warning on Chinese social media. He urged caution over the new highly contagious virus, which was later named the CCP virus or COVID-19. On New Year's Eve 2019, China made an official announcement about cases of a viral pneumonia, though it still did not publicly admit person-to-person transmission. The same day, Taiwan tried to sound the alarm by alerting the World Health Organization to possible signs of human transmission, something Taiwan officials later said the WHO ignored. The island also put protection measures in place that day, especially in its airports, becoming the first in the world to do so. The situation really started ramping up as the world entered 2020. Wuhan's virology lab completed the full genome sequencing of the virus on January 2nd. But the information was not shared with other nations until more than a week later. According to leaked documents from the following day, China's National Health Commission told regional health authorities to increase precautions against what was called a major sudden outbreak of infectious disease. At the same time, a number of early whistleblowers were silenced by police. That's including Dr. Li Wenliang and other 7 doctors from Wuhan. Authorities accused them of spreading rumors. Reports from the Associated Press say that by mid-January, Chinese officials determined that the world was likely facing a full-blown pandemic. But they kept the information quiet, choosing not to inform the public. A day later, on January 15th, Chinese officials announced that the risk of human-to-human infection was low. The notice is in contrast to an internal document obtained by the Epoch Times, which reveals health officials already knew about the severity of the virus and were preparing for human-to-human transmission and mass virus spread. The announcement came just ahead of China's Lunar New Year celebrations. Because officials downplayed the danger, 40,000 families gathered in Wuhan to celebrate. Human-to-human transmission was finally announced in China 2 days later, on January 20th. But the damage was already done. The city of Wuhan imposed its first lockdown on January 23rd. By then, 5 million people had already left the city for destinations around the world. Days later, with lockdowns in full swing, Wuhan's mayor admitted that disclosures about the outbreak hadn't been timely. But he blamed China's central regime authorities. By the end of January, the WHO declared the outbreak a global health emergency, all while praising China's response. The University of Southampton released a study months later, stating that if China had responded to the outbreak 3 weeks earlier than it did, virus cases could have been reduced by 95%.